It was late afternoon. The kids were home from school and I was just starting supper when I heard it. Station 170, ambulance needed, 60-year-old male, unconscious, not breathing, drug use suspected. As I ran out the door to go meet up with the ambulance, I had the whole scene already pictured in my head and I knew exactly how I was going to respond. How important is patient communication? Doesn't it just come naturally? We ask questions, they answer. How hard could it be? I've been in EMT for 15 years, and I've seen many examples of both good and bad communication and the results of it. But why do you need to know this? Why is this important to you? We all need to be able to communicate. We all need to be able to work with those and help those around us. We're going to talk about some of the skills of active listening and clear communication. So we're going to start with active listening. I want to show you this kanji. This is the Japanese kanji for listen. It's really interesting because of the parts. Here you have a kanji that means ear. Here is you. This part represents the I. This here represents the one, or our undivided attention. And this bottom part here represents the heart. Can we see how all these together can better signify listening? As we talk about listening, we're going to talk about the parts of listening. First of all, one of the main things that we do when we listen, most people listen long enough to form a response. But what we need to do is actively listen to gain understanding. There's something called Miller's Law. It's named after psychologist George Miller, who said, in order to understand what another person is saying, you have to assume their answer is true and try to imagine what it could be true of. Many times we reverse this idea and we listen competitively, or we listen for comeback. We listen for a way to form a comeback. The second idea on active listening is listening without judgment. In the case of my patient that we talked about, what happened? Well, when we got to the scene, we found exactly what I expected to see what I had expected to see. There was a patient that was rough looking, unable to communicate clearly. We couldn't understand what he was saying. He wasn't following commands. We got him in the ambulance and started treating for a drug overdose. But we'll come back to him in a minute. How do we listen without judgment? Well, everyone has the right to be themselves. Everyone has the right to be understood. I saw a great example of this in a piano, in a young man playing a piano. He had two pianos sitting side by side. On the first one, he played a beautiful piece. It was so fun to listen to. Then he turned around to the second piano. Well, the second piano, it still had the same 88 keys. It looked exactly the same, but when this young man started playing, it was obvious that every key had been tuned to sound exactly the same. So although the young man was playing with the same spirit and energy in the exact same piece he had just played, all the keys, when they sounded the same, were drab and uninteresting. We all have the right to be ourselves. We all are different. Try to listen to another without judgment. A third idea of listening is showing empathy. Of effective listening and active listening is to be able to show empathy. Here's the definition of empathy. The empathy is the action of understanding, being aware of, and sensitive to the feelings, thoughts, and experiences of another. How do we listen with empathy? We make eye contact. We get down to their level and we use appropriate touch. I had a lesson on listening with empathy at a call of a young girl that had committed suicide. Her father came home from work and discovered what had happened, and we were called to the scene. We came to the scene to find the father sitting on the sidewalk in tears. There was nothing we could do for his daughter, but there was a lot that we could do for him. He was now our patient. So what did we do? We sat down on the sidewalk beside him. I put my hand on his shoulder, and I didn't know what to say. The only thing I could think of to say to him was, "Who was your daughter? What was she like?" And I sat and listened as he described a beautiful young girl. It was all that we could do. The next idea of listening is to listen with your eyes. There are so many nonverbal cues. What do you see around you? What does the patient's voice sound like? Is he speaking fast? Is he speaking slow? What are his body movements telling you? What are the clues around that you see around the patient matching up with their story? Next, we're going to talk about effective communication. What are some of the steps of effective communication? Well, the first one is you need to be clear. When a patient is in an emergency situation, they are under a lot of stress and may not be capable of reasoning. Use clear, easily understandable words. Try to avoid jargon or words that might be too difficult for them to understand. The second idea is the need to be concise. The patient is overwhelmed and struggling to focus, so you need to be as brief and clear as possible, as brief and accurate as possible. Use short phrases of just a few words and be very accurate in the way you talk to them. A third way to communicate clearly is to be courteous. This is where the golden rule applies. Treat them the way you would want to be treated. When you communicate respectfully and professionally to a patient, they are more likely to communicate with you in the same manner. Well, I want to tell you the end of the story of the man we picked up. We got him to the hospital, and the doctors started running tests. And when the tests came back, I was stunned and saddened by what was found. There were no drugs or alcohol of any kind in the man's system. But what the test did show was the man had had a heart attack that triggered numerous strokes that in turn triggered multiple seizures. My lack of effective communication with this patient was heartbreaking. What more could I have learned by listening actively and communicating clearly? What clues did I miss by assuming what I thought was the situation? Learn from my mistakes. Practice these skills. Communicate, listen actively, and communicate clearly. And you will find that you can learn more things than you already know.